Debating the feasibility of free healthcare, economics, quality of care, and societal implications. Imagine a world where healthcare is free and accessible for everyone. Sounds ideal, right? But is it truly feasible? Healthcare is often viewed as a fundamental human right, yet the notion of free healthcare raises complex questions about economics, social equity, and the sustainability of healthcare systems. While some countries have managed to implement systems where healthcare costs are minimized for patients, the idea of completely free healthcare is more nuanced than it appears. The economics of healthcare costs of providing care. Providing healthcare involves significant costs. Hospitals, clinics, and healthcare providers incur expenses for staff salaries, medical supplies, equipment, and infrastructure maintenance. Even in systems where healthcare is publicly funded, these costs do not disappear. Instead, they become the responsibility of taxpayers. Funding sources. The assumption that healthcare can be completely free overlooks the reality that it must be funded somehow. Free healthcare typically means that costs are covered by the government. However, this necessitates increased taxation or diversion of funds from other critical areas such as education or infrastructure. This leads to questions about whether society is willing to bear such financial burdens. Economic inefficiency. Governments are not always the most efficient at managing resources, leading to potential waste and misallocation of funds. Bureaucratic overhead can be significant, and inefficiencies can lead to increased wait times, lower quality of care, and poorer health outcomes. The impact on quality of care resource allocation. In a system that provides care free at the point of use, there can be a misalignment of supply and demand. If patients know care is free, they might overutilize services, leading to longer wait times for those in genuine need. This can mean that those who require urgent care may not receive it promptly. Incentives for providers. Free healthcare can diminish the incentive for healthcare providers to offer high-quality care. In a profit-driven model, providers strive for efficiency and patient satisfaction to retain customers. Without this incentive, the motivation to innovate or maintain high standards can diminish.